Hello, everybody. Greetings from Mankind, Heart Care Foundation of India, and IGCP Group. We gather here together on a note to pay our respect and prayer to the doctors from Gujarat who has sacrificed their life so that others can live. This is a type of a CSR project of Mankind in association with Heart Care Foundation of India and IGCP Group. Normally, whenever we have a prayer meeting, we have a bhajan sandhya. But here we dedicate this type of a session to knowledge. But from bhajan sandhya, we shift to knowledge. And when we talk about the knowledge, we talk about what's happening in the society today and how to reduce the mortality. Our basic objective is that whoever has sacrificed his or her life, no more sacrifice is required. Let us remember them forever for their sacrifice, and let's now save the society. So I'll hand it over to Dr. Manish Chaudhary from Mankind to introduce what Mankind is doing, and also to introduce our chief guest, Dr. Raghu Satyanarayanan, an eminent physician from Gujarat. After that, I will ask Raghu to speak a few words. It will be followed by a 20-minute session on how to reduce the mortality. And then we will have a formal function where we will acknowledge sacrifices done in the state of Gujarat, and we'll acknowledge each one of them. Over to Manish.
Thank you, sir. Good evening, everyone. On behalf of Mankind Pharma, I take this privilege to welcome you all in paying a tribute to the COVID martyr doctors from Gujarat, the real heroes who have risked their lives to protect the lives of others and made this world a better place to live. So we today join together to pay tribute to them. In doing so, I'll just take a brief about what Mankind Pharma is, a brief introduction about Mankind Pharma. Established in 1995 under the leadership of Mr. R.C. Juneja, Mankind Pharma is today ranked number 1 in terms of overall prescription generated and ranked number 4 in terms of total revenue in Indian pharma business. We generate an overall revenue of nearly $1 billion per annum. And we have a strong presence in prescription drugs, OTC, and veterinary medicine. The philosophy of Mankind Pharma over the years has been, in serving life, has been quality, providing quality medicines at affordable price and making it available at every nook and corner of this country. Because we at Mankind Pharma believe that any person residing in this country, irrespective of where he or she is residing, has the right to have quality medicine at affordable price, because in Indian context, the price really matters. And since nearly 50% of our population still resides in far rural areas, so getting it available to their doorstep becomes very vital for the patient. Some of the milestones that we have achieved over the years: 1995 was the year when Mankind Pharma was formed. It was the foundation year for Mankind Pharma. 2007, we launched our operations in OTC and veterinary medicine. 2008, we were ranked number 1 in terms of overall prescription generated. 53 of our brands were ranked in top 5 position in their respective segments, therapeutic areas. 21 of our brands enjoyed the number 1 position in their respective therapy areas. 2011, we have set up our state-of-art research and development center in Manesar, which is just outside Delhi NCR. 2012, we started our international operations. 2013, we have entered into the CIS states, and we were again ranked number 1 in terms of prescription generated. 2014 was the year when our flagship brand Manforce Condom increased its market share to 27%, and 2017 we started our operations in US market. 2019 we have acquired a manufacturing capability in US, and our manufacturing unit in India was certified with US FDA certificate. We have a strong presence in nearly all therapeutic areas such as anti-infective, gastroenterology, cardiology, diabetes, nutraceutical, dermatology, and many more. With our innovative products, innovative newer mode delivery mode products, uh, products with a better bioavailability, and products with affordable and quality. That is what we are proud of today. Our R&D Research and Development Center in Manesar, we have around 400 plus dedicated scientists which are working day and night over various projects such as clinical trials from phase 1 to phase 4 clinical trials, regulatory filings, biopharmaceuticals, new drug development, advanced farm PKPD modules, and biostatistics, and even toxicology studies. So we sincerely thank all the healthcare professionals for their kind support and partnering with us and helping us grow the way we have grown today. During the COVID pandemic, we did take our baby steps in terms of helping the Indian at large by donating 51 crores to the PM Care Fund. Our entire team donated 1 day salary to the fund. We have provided mask, PPE suit, around 15 lakh masks, 1 lakh PPE suit, 12 lakh sanitizers, and around 12 lakh plus medical equipments to medical fraternities so that they could be equipped to fight the COVID menace. We have contributed in our small ways by paying our tribute to the COVID warriors. Our team has contributed around 8.5 crores to the families of police martyred who laid their life in fighting against COVID. And we have also worked in towards facilitating the people who were working in hard during the COVID and were in need of support. We once again sincerely thank all those doctors, salute them for their relentless effort in fighting against this pandemic and coming out and helping the entire community and the country at large in fighting this menace. And really, we salute these heroes as they have risked their lives to protect the lives of those whom they might not even be knowing, and risk not only their lives but also risk the life of their loved ones, as everyone who is a family member of a doctor is at risk of getting this infection from him or her. So we today at Mankind salute their uh, efforts, and I once again welcome you all in paying our tribute to COVID martyr doctors from Gujarat. I welcome Dr. K.K. Agarwal, sir. He is a recipient of several awards, 4 national awards, Padma Shri, Vishwa Hindu Samman, Dr. B.C. Roy National Award, and many more. He is a Limca Book record holder. He has got 3 records, Limca Book records to his name. Gold medalist, Tech Talk speaker, recipient of FICCI Healthcare Personality of the Year 2016. President Confederation of Medical Association Asian and Oceania, President Heart Care Foundation of India, and Group Editor of Chief in Chief IJCP Group. He was the past National President and Honorary Secretary General of Indian Medical Association, past President Delhi Medical Association and IMA Delhi branch, former editor committee member of Medical Council of India, ethics committee member of Medical Council of India, and former chairman ethics committee Delhi Medical Council. With him we have Dr. Raghu Satyanarayan. Sir is an eminent physician from Gujarat with over 38 years of experience and serving the community at large. And he makes sure that he attends various conferences to keep pace with respect to recent industry trends and latest developments. And a keen teacher, we have seen him take the effort in teaching people and how relentlessly he takes out his time in doing so. So with this, I welcome Dr. Raghu. And today we have a topic on combination therapy in COVID-19, focus on Ivermectin, doxycycline, and Zinc, presented by Dr. K.K. Agarwal, sir. Sir,
Thank you, Manish.
Yeah.
So before I speak, would like Raghu to say a few words.
Dr. Raghu, you can unmute yourself.
Yes, Raghu.
Yeah. Good evening, sir. It's a great honor to be with you today in the evening CME session, sir. So I'm privileged to be with you today in the evening to chair your session. It is a great learning time, sir, with you. But I've also attended so many of your sessions and all your articles also, which are being published. It's a great learning time and learning sessions. So COVID is such a disease that we keep on learning. We as doctors, we are learners for life. If you keep learning, you are in tune with the latest, and COVID changes every day its colors. A dangerous virus, highly contagious, unpredictable. We can't predict how it will behave. A patient with CT, RT-PCR score with a CT value of 30 also may land up in the ICU on oxygen, on ventilators, and he may pass off also. And the only message should be prevention, 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 and prevention to against this virus. And the London virus making its rounds across the globe, we don't know how dangerous it is and how will it behave to the patients. We just know that it is highly contagious and it moves very fast. So that's all we'll know. We will learn more and more also from you, also from your session, sir. And with this brief introduction, Dr. K.K. Agarwal can start his presentation, and later we move on forward, sir.
So thank you, Raghu. I will devote this and dedicate this lecture to all my colleagues from India who have sacrificed their life and focus on how to reduce mortality in our country. That's our objective. I will start from some slides. Greetings from Heart Care Foundation of India, a charitable not-for-profit organization, and Med Talks at IGCP, which is a communication house. And together, we reach millions of people on a monthly basis to create awareness about taking out the fear of the mind of the people. Today, I'm going to focus on combination therapy with a focus on Ivermectin, doxycycline, and Zinc. Now, why have we chosen this subject? So I want to spend some time into it. The COVID vaccine is approved. By tomorrow, we expect the letter to be issued. And the first COVID vaccine in India will be launched maybe in the next week. We expect 30 crore people to get vaccinated in the first couple of months. The first dose will be given. And the second dose is to be given after 1 to 3 months. That means the first dose itself will make the disease milder if they happens to get the COVID-19. So as far as the Covishield is concerned, the very fact the government says that second vaccine can be taken between 1 and 3 months. That means the large window tells us that the first dose of the vaccine will give us partial immunity. And that's a good news, that even if you start getting disease, you will get a milder disease. And then we know that there are mutations coming, so we are afraid. All mutations will make the virus more contagious. Again, means a mild disease. Remember, mutations are held in such a way that the his virus entry inside becomes very swift, and also virus doesn't die. अंदर घुसने के लिए वायरस को रास्ता मिल जाए और कोई उसको एंटीबॉडी मारे ना. That is the objective of a mutation. Up till now, there were different types of mutation called L, S, V, G, GH, GR, and GV mutation. But let's see what are the mutations coming now. When we talk about this G mutation, which is the most common today, G, GH, and GR, and GV, G is common there, and that G is called as D614G mutation. Now see here, above is the virus, below is the spike protein. And in this spike protein, you see S1 and S2. The bifurcation of S1, S2 is 679 amino acid. From 318 to 510 amino acid is the area called receptor binding domain. And 424 to 494 amino acid is the receptor binding moiety. This is the lock, this is the key, and this is the complete spike. So the thing which locks my ACE receptors is RBM. So whenever there is a mutation, I start looking for where is the mutation. So the current G mutation is in S protein, S1, non-RBD. 614 is after between 510 and 679. So it is contagious, but not highly contagious because this is outside RBD and RBM. Now let us see, there is a mutation in Nigeria, 681, that is at the bifurcation of 679. This means 681 mutation is important because this modifies the virus where it cleaves. This is the cleaving area between S1 and S2. Therefore, 681 is an important. It will cleave early. That means it will cause contagiousness. Now, there is a 440 mutation in India, in Andhra Pradesh, and you see 440 is in RBM. Therefore, this is a significant mutation in India, but this is a single mutation because which is significant, but it is not containing other serious mutations. In Kerala, there are two mutations. Both of them are in near SP and near CP, so therefore they are not significant. Then we have 23 mutations in UK. The 501 mutation is in RBD, but not in RBM. Therefore, 501 mutation is more important than 614 mutation. And we can see here, it also has a deletion of 6970. And that deletion of 6970 and also the Nigeria strain, that is 681, is making it more contagious. Australia also has a strain that is again 477 in the RBM, like Andhra Pradesh. It is also a strain like Andhra Pradesh, but not making that much impact. Then we have 3 mutations in South Africa, 2 in RBD and 1 in RBM. So from virus point of view, South Africa strain is more contagious than the UK strain. But UK strain is not only more contagious, but it also not allowing the antibodies to act on it. Therefore, it will last longer in circulation. So one thing is clear, that all the mutations are causing high viral load. Along with that, they are causing low mortality, low virulence. So they have high viral load and low mortality. This is what Raghu was talking about, that you can have low viral load and still you have high mortality. But I'm talking about there will be high viral load. This virus is causing very high viral load, yet low mortality. This is just the reverse what Raghu was talking about, and that's a good news. And with this, when we know there is a high viral load, it becomes very important for us to kill the virus. It becomes very important to us to understand antiviral drugs. Now remember, this disease causes acute, manageable, thromboinflammatory, immunogenic, viral, contagious disease. Therefore, if a inflammation comes, I can treat. If a thrombosis comes, I can treat. If there is a immunologic reactions, I can treat. But inflammation starts on day 3. Inflammation starts on day 3, 4, and 5. On the first day and second day, if I can give an antiviral, why not? Unfortunately, my antivirals today, remdesivir and favipiravir, both takes 48 to 72 hours to act. Remdesivir is still slightly better than favipiravir, but they take time. That means if I have only day 1 and day 2, and my antivirals are not going to act, and I want to reduce my viral load, I don't want to go into inflammatory and a thrombotic state. then I need to look for other antivirals from the amongst available repurposed drugs. And then I want to choose an antiviral which has also an anti-inflammatory action. So I want an all-rounder. So I don't want pure antiviral. I don't want pure anti-inflammatory like a bowler and a batsman. I need an all-rounder which can act in the high viral load and can also reduce inflammation. Therefore, that may not happen. Therefore, I need a combination therapy. And that combination therapy should act at different mechanisms. So instead of one, if I have three all-rounders, you will find in a match, India will always win when they have more all-rounders than pure batsman or a pure bowler. So there is an advantages of a combination therapy. Combination therapy doesn't mean that it has to be 3-in-1 medicine. It doesn't have to be a fixed dose combination. We are going to talk about the role of 3 drugs today, and that is Ivermectin, doxycycline, and Zinc. Ivermectin is listed as an essential medicine in WHO. So Ivermectin is listed as the essential medicine in the list of essential medicines. It's safe, easily available, can be given without any side effect. Ivermectin and albendazole combination has been advocated twice in a year. In India also, 10th of February and 10th of August, we have a deworming day. Doxycycline is the broad spectrum drug. Available in India, there are only 2 broad spectrum antibiotics, doxycycline and cephalexin. It is a drug which has antiviral, anti-dengue. It has a drug which has an anti-malaria effect. It has anti-atypical bacteria effect. It is a drug of choice for typhus type of infections. So therefore, doxycycline is a broad spectrum antibiotic. It can take care of secondary infections in COVID-19. And then comes is zinc. Large deficiency of zinc in our country. And all 3 of them have some degree of antiviral and anti-inflammatory action. Therefore, if we start them on day 1 or before day 1, even in a patient who are having a exposure history, we may be able to reduce the mortality. We may be able to reduce the severity of inflammation and severity of thrombosis. So I'm now, as a lawyer, going to debate my hypothesis that ivermectin, doxycycline, and zinc are necessary in pre and during phase of COVID-19, pre and early phase of COVID-19. Now here you can see when the virus enters my body. When the virus enters my body, it has 3 functions. It hijacks the photocopier machine. Therefore, it will translate, proofread, and it will replicate. Now, if you give here, most of the medicines here are mentioned here at different places. In every section, you can give an antiviral situation. So favipiravir and remdesivir worked at the level of replication, but I can use doxycycline, ivermectin, and zinc. Zinc will not allow virus to enter in. We will talk about it later, how they act. But we are looking for a medicine which acts at one of these factors, along with it causes anti-inflammatory action. So natural course of COVID-19 is the first phase is viral replication. In the second phase, immune dysregulation starts. So I am putting a game that I'm more concentrated on viral replication. At this phase, if I can kill the virus and have a drug which also works at the level of immune dysregulation, that's an all-rounder. So I need an all-rounder which reduces viral replicate. So I see interferon, only viral replication, ASA, only viral replication, enoxaparin, only after the immune dysregulation, methylprednisolone, only once the immune dysregulation starts. So on the left side are my batsmen, on the left side are my bowlers, but ivermectin is an all-rounder. So therefore, ivermectin is working at the level of viral replication as well as immune dysregulation. So is doxycycline, so is zinc. Next. So similarly, we need a medicine which works at all the three levels. And if I say pre-exposure, post-exposure, incubation period, symptomatic phase, and pulmonary phase, different medicines, if I need an all-rounder, ivermectin comes as the all-rounder. No other drug is an all-rounder. That does not mean that we do not need corticosteroids. Yet, yes, we need a net batsman, we need a bowler, but we also need a person who is all-rounder. So ivermectin, he is a all-rounder. If you see in a mild COVID, which is going to be the cases from now onward, once you have vaccine and mutations, cases are going to be mild. Their role of doxycycline, ivermectin, and zinc comes in every case with highly recommended ivermectin. Melatonin, famotidine, vitamin D, B complex, vitamin C, fine. So, but when it comes to an all-rounder of par excellence, then it will be zinc, ivermectin, and doxycycline. So let's go one by one. Let's talk about ivermectin, then doxycycline, and then zinc. Ivermectin is a potent inhibitor of SARS-CoV-2, clinical isolate. This is a study from Australia. So therefore, it inhibits replication of the virus. So it inhibits the replication of the virus. So ivermectin is an inhibitor of virus. A single treatment can reduce reduction in virus in 48 hours in cell culture by 5,000-fold. It is FDA approved. It's easily available. WHO considered it as an essential medicine. If you see number of trials, 1, 2, lots of trials are going on. So it is not like that you are using it without any clinical proof. The use of ivermectin is associated with lower mortality in hospitalized patients. That's a study which talks about serious cases. We have talked about mild, now it's talking about serious cases. A 5-day course of ivermectin is safe and effective in treating mild COVID-19 adult patients. So therefore, in mild cases, prevention, mild cases, and severe cases, ivermectin can be used. AIMS Bhubaneswar study that they thought ivermectin prophylaxis resulted in 73% reduction in COVID-19 infection. And they also found that amongst healthcare workers, there was 73% reduction of COVID-19 as a prophylaxis. So it has a prophylactic action amongst doctors as well as amongst the patient's relations. So when we talk about ivermectin again here, this is a previous slide. I'm repeating it here. Ivermectin, benefit, and benefit. Pre-exposure, post-exposure, ivermectin, symptomatic, ivermectin, pulmonary inflammatory phase, ivermectin. So ivermectin, famotidine, and doxycycline. This is a suggested combinational therapeutic for treatment of COVID-19. Remember, famotidine works at the level of replication. It stops the replication by inhibiting 2 enzymes there. So this study talks about that ivermectin and doxycycline. Here they have taken famotidine instead of zinc. Now, the last study, the committee has recommended different doses at different ages. There is no need for repeat dose in moderate to severe cases of COVID-19. So up till now, we have talked about mild cases, then severe cases. Now it talks about moderate cases. There is no need of repeated dose because ivermectin is metabolized in liver. You have to be cautious. So you can even give a single dose will make all the difference. Even if you give a single dose is sufficient. That's what this study talks about. The UP government has given it as a guideline for all the patients in Uttar Pradesh. Prophylaxis and treatment. Treatment continuous daily for 3 days, and as a prevention for 2 people, for close contacts and for healthcare workers. For close contacts, day 1 and day 7. For all of us who are working in the field, day 1, day 7 and day 30. And after that, once in a month. IMA recommends Ivermectin 1 tablet per week for healthcare workers. This is EVMS study, a management protocol. And this also talks about Ivermectin 12 milligram in symptomatic and incubation period, and then continuing Ivermectin in the virus phase. Prophylaxis, it talks about Ivermectin for post-exposure prophylaxis. Again, different protocols are available. This is Center for Digestive Disease Protocol. Again, this is Center for Digestive Disease Protocol. I would recommend a Indian Medical Association protocol, and that is for prophylaxis, take Ivermectin once in a week for healthcare workers. Or you can follow a UP protocol, which is once in a month, but in the first month, it is day 1, day 7, and day 30. So we have made a case for Ivermectin, that Ivermectin is a must. Now let's talk about doxycycline. I have to give an antibiotic. If I'm giving a steroid, I need an antibiotic. I need an antiviral action. So it is an antiviral and anti-inflammatory effect. So it gives me an all-rounder. It covers atypical bacteria, and it also covers atypical associated lung sequel complications. So if I need an all-rounder anti-inflammatory antiviral, that's doxycycline. The use of doxycycline in dengue regulates cytokine releases. That's a proof from dengue. One study, lots of studies. And then doxycycline is anti-inflammatory in the RNA effect. It inhibits SARS-CoV-2 papain-like proteases, therefore it has an antiviral effect. It reduces IL-6 and TNF-alpha, which is the first response. In the first 2 days, the first response is TNF-alpha and IL-6. Third day, you have IL-1 beta pyroptosis starting. Once the pyroptosis starts, patient is highly inflammable. But if I want to reduce my sickness in day 1 and day 2, doxycycline is the drug to be relied upon. So these are the studies which talks about comparative antiviral efficacy of doxycycline and chloroquine, and it gives an anti-inflammatory action. So antimicrobial, anti-malarial, and anti-inflammatory action. And it says 100 milligram daily can be a prophylactic dose. In treatment of 200 milligram per day for treatment, and 100 milligram a day for prophylaxis, specifically for those people who have a close contact. We can give them Ivermectin on day 1 and day 7, and we can give them doxycycline on 100 milligram daily for 4 to 5 days, for 5 days, because after 5 days, if they do not develop any symptoms, we know that they are not going to get COVID-19. So these are different types of protocols available from Bangladesh. But I again come back in doxycycline is the doxycycline 200 milligram daily started on day 1 is antiviral and anti-inflammatory. And in close contacts, you can give them Ivermectin, start with Ivermectin and doxycycline 100 milligram daily. Ivermectin to be repeated after 7 days. So one first stat dose Ivermectin with the doxycycline 100 milligram for 5 days. On 5th day, if they do not develop symptoms, it's taken for granted that either they have aborted or they are not going to get COVID-19. Zinc is antiviral as well as anti-inflammatory. Zinc deficiency is present in India in 20%. And its antivirus log is because of metallothioneins. Now, if here you will see zinc at mucociliary clearance, zinc is useful. At SARS replication, zinc is useful. Antiviral immunity, zinc is useful. Inflammation, zinc is useful. Co-infection with other bacteria, zinc is useful. Pneumonia, ARDS, ventilator-induced injury, zinc is useful. Aging, diabetes, obesity, atherosclerosis, deficiency, zinc deficiency can precipitate these illnesses. Therefore, zinc is a must. So there are trials going on of intravenous zinc, and this says that zinc can protect vital organs such as heart, kidney, and liver because of lack of oxygen. So zinc is also necessary when you have hypoxia. And this is a frontline COVID-19 critical care alliance, which talks about zinc as prophylaxis, zinc and zinc as prophylaxis, and zinc in a outpatient protocol. So I am going to end by giving my arguments in favor of three things: ivermectin, doxycycline, and zinc. Ivermectin predominantly is antiviral. If I start it on day one or day of exposure, it makes sense. It is a stat dose. I can continue it if it becomes positive for another doses for daily dose for 3 days. But ivermectin is the drug to be misused. It's safe, it's antiviral, it's anti-helminthic. So when in doubt, take ivermectin. Don't wait for the diagnosis to come. If you have a doubt, you need an antiviral. Remember, other antivirals will take 48 hours to act. Doxycycline is the, as per IMA guidelines, and which we publish, an API, IMA API guidelines. We all very clearly said doxycycline is the drug. When in doubt, you want to use an antibiotic, give doxycycline. We are not sure what fever it is, give doxycycline. It will take care of all types of a broad spectrum. Still, it has an antiviral and anti-inflammatory action. Zinc, because of this COVID-19, all of us are zinc deficient. Why? During this COVID-19, during this lockdown, one thing we have done is that we are washing our vegetable 15 minutes, 20 minutes, repeatedly we are washing our vegetables. And when you wash, most of the ingredients, including folic acid, gets disappeared. And in COVID, we have GI involvement in COVID. In 40% of the cases, there is a GI involvement, and zinc is absorbed from small intestine. So there is presence of zinc deficiency amongst us. Therefore, I rest my arguments and ask our judge, Dr. Raghu Satyanarayan, to give the verdict that my argument is that as on today, specifically in the time to come with high viral load, mild diseases, which we likely to have from the mutations, we need to act early, hit hard, and we need to have alternative antiviral drugs, specifically after the statement which has come that misuse of drugs can cause mutations. So misuse of antiviral drugs late in the treatment, not early in the treatment, specifically RDRP inhibitors, can cause more mutations. So therefore, if you have a case, if either you have a history of contact, a case, suspected case, case contact, or a early case, start ivermectin early, start doxycycline early, and start zinc early. Over to you, Raghuji, for your comments.
Thank you, sir, for your brilliant presentation. Very well said, sir. I also do the same practice what you mentioned in your talk, and elaborate talk, sir. I give ivermectin, doxycycline, and zinc, and add on vitamin D, also hammer dose of vitamin D, 160K, one daily for 3 days. So I also practice the same way. And if the patients are sick and likely to worsen, so I immediately put them to the hospital and give them remdesivir injections. Steroids are very carefully used because only if there is hypoxia, then only we think of steroid. But mild cases, this is the right protocol, rightly mentioned, sir, and all the doctors who are listening to your talk said they should get a good carry-home message. Indiscriminate use of drugs and even favipiravir many a times, so may not be required. Patients might get better even without favipiravir. And if you use only these 3 drugs, they would definitely get better also. Many a times favipiravir is being used right, left, and center. So thank you, sir, for your brilliant talk.
Thank you, Raghu. Thank you to Manish for the actual purpose for which we have gathered here.
Yes, sir. Thank you, sir. Thank you for the wonderful talk, sir. And with this, I would request Dr. Raghu, sir, if he would like to say something for about the evening.
Yeah, I would first of all sincerely thank Mankind Pharma for giving me an opportunity today to chair this session with Dr. K.K. Agarwal, sir. And it was a real good evening today where we learned that the way we should practice COVID-19 rather than indiscriminately using drugs. However, the purpose of today evening's presentation was to honor those people those doctors who have lost their lives handling COVID cases. So among the several lessons this corona pandemic has been teaching us, the biggest one is to find ways to sufficiently invest in the better and more efficient medical fraternity and give medical professionals the respect, the compensation, and infrastructure that they truly deserve once this crisis is over. I think the respect and compensation Mankind Pharma is going to do this evening. Moreover, the world needs to work towards the advancement in medical research and technology. Nothing will be a greater tribute to the healthcare workers than this. With this few words, I would give Dr. Manish, I think you can tell the names of those doctors who lost their lives handling COVID. So it is Mohammad Hussain Ghulam Mohammad Momin from an eminent physician, and he used to do free of cost consultations and famous for his kind and supportive all over Dholka district. He was very good. And
Next.
just hide this. Next. So Dr. Kamlesh Bhagwandas Taylor, again an eminent medical practitioner and general physician and surgeon with 25 years of experience, used to arrange free health camps to the society on a weekly or monthly basis. He was well known due to his nature and quality treatment in low cost in our area. Again, tribute to him also. Next, please. Dr. Sandeep Kumar Dave from Ahmedabad, Paladi area. He was a very senior general practitioner, and I also knew him because he used to attend my lectures on diabetes and he used to regularly come to all the CMEs. Very senior general practitioner practicing in Paladi area. He also lost his life with 40 years of experience. Dr. Sandeep Kumar Dave from Ahmedabad. Next, please. Dr. Rajesh Desai from Navsari, a senior most MD radiologist in the city. 40 years of sonography and radiology practice. He was gentle, generous, and always ready to help others and everybody in the family. Miss him. That is for sure. The person who is gone, the closest person, the family members are the people who really know the pain, what happens because what has happened because of their loss. Next slide. Dr. Anil Poonabhai Khergamkar. Again from Navsari, he was an eminent physician with private general practice, 36 years of experience, was a firm believer of talent. He played a huge role in Mayavanshi, Shiksha, and Pracharak Sangh. His contribution towards the society and social work will always be cherished and missed at the same time. He made a name for himself with social service, and he always used to be ready to help attitude. He did not limit to his profession, but also guided people with his intelligence, experience, and knowledge. A selfless person who never gave importance to money and was a leader for the masses. A happy soul with an evergreen smiling face that could just light up any room. His presence is always going to be a heart forever. Next, please. Dr. Ashok Sakaram Kapse from Surat, Gujarat, senior most pediatrician, worked in Kalavati Saran Hospital, Delhi as a senior registrar, assistant professor at Government Medical College, Surat, teacher for DNB, head of the department at Mave Super Speciality Hospital, 48 years of experience, 9 Oration Awards, chapters on dengue, malaria, IAP, textbook of pediatrics, excellence award by ATAC for research in dengue illness, Z News Award for original researchers in dengue illness, biggest contribution in how to treat dengue at the local level, editor of many journals and books, Dr. Ashok Sakaram Kapse from Surat. Next, please. Dr. Pitalia Mayank Ramanik Lal, again from Bharuch, Gujarat, an eminent physician, used to practice in a private hospital in Bharuch, 37 years of experience, senior most pediatrician in Bharuch city. He was very honest doctor, always doing his practice very rational. Dr. Hitesh Vallabhai Lathia from Surat, an eminent physician and medical officer at Venus Hospital, Surat, 5 years of experience. During this COVID pandemic situation, he was doing day-night duty in COVID ward at Venus Hospital. Young guy, very honest, hard worker, and always used to be ready to help all the patients. Dr. Prakash Govindbhai Patel from Junagadh. He was an eminent physician with 45 years of experience. Senior doctor from Junagadh. I alone cannot change the world, but I can cast a stone across the waters to create many ripples, wonderfully said by Mother Teresa. So which all the doctors across the globe are doing today. Definitely they are doing a lot of good work and brilliant work, risking their own life in trying to treat coronavirus patients and risking their own lives in this. I also lost a dear friend of mine who was a radiologist here at Apollo Hospital, Ahmedabad. He was a very senior radiologist and he was doing a brilliant job. He got admitted on the 1st of December. On the 6th, he was put on the ventilator. On the 20th, he lost his life. His name is Dr. Sandeep Jhala, a very brilliant radiologist from our city and a very, very good doctor and a good human being. I lost him also in this COVID in December. Very sorry for the whole family and very sorry. Next, please.
As we remember them today, I would now like to invite Ms. Hiren Taylor, younger brother of Dr. Kamlesh Taylor. आपको अनम्यूट करना पड़ेगा.
Can you take the slides off? Yes, Hiren ji.
हिरेन जी आपकी आवाज नहीं आ रही.
तब तक आप दूसरे को ले लीजिए, उसके बाद में तब तक इनका
Take other by the time we get. We are joined with Ms. Tejani Yash Shah, daughter of Dr. Sandeep Dave. Ms. Tejani, can you just...
Hello, everyone. I am daughter of Dr. Sandeep J. Dave. He was a very well-known family physician and practitioner of our area, practicing over 40 years. He was not only a family physician, but he treated his patients like a family member. He was treasurer at Paldi Vasna Medical Association, and he was president at Ahmedabad Family Physician Association. Recently, Indian Medical Association just gave him a certificate award for his selfless services during this pandemic. And we all family members are so proud of him because in spite of heavy risks involved, he never closed his clinic. We all members kept telling him to, it is not necessary for senior citizen to open his clinic, but he didn't listen to us. And he said, Sorry. The life goal of my father and all other doctors like him is serving lives and treating patients very well, just like Mankind Pharma. The company's motto says, wherever you are, we will take care of you and your loved ones. And by taking this big step of giving tribute to all the families of martyr doctors, company is really standing by its pledge. And I would like to thank the company and we all on behalf of our family members. And the company is really doing great. Thank you so much.
So Tarjani ji, the Bhagavad Gita chapter 3:35 clearly says, those people who die while serving their duty, they are far better than people who die and who take away their duties and start doing something else. So we are proud of him. So if you lose your duty if you lose your life while doing your duty, these are the people who, according to Bhagavad Gita, are the people to be remembered. Thank you, Tarjani ji.
Thank you so much. Thank you so much.
We are joined by nephew of Dr. P.G. Patel, Mr. Yatin Bhai. Yatin ji, आप unmute कर सकते हैं. You can unmute yourself.
मैं मैनकाइंड कंपनी को पूरे दिल से धन्यवाद कहना चाहता हूं, क्योंकि जिन समय हम परिवार लोगों को जरूरत थी, तब काफी कंपनियां अपनी दवाई बेचने के लिए हर साल आया करती थी, हर दिन मिला करती थी। लेकिन इन समय जब हमें जरूरत थी कि कोई आके हमें पूछे कि आपके घर में क्या हुआ है, और आपकी कंपनी ने बहुत ही बढ़िया काम किया सर जी। सैल्यूट आपको और आपकी कंपनी को, और कंपनी के जिन लोगों के दिमाग में एक ख्याल आया कि जो डॉक्टर्स है, जो इनके अंदर डेथ हो गए कोविड के अंदर, उनके परिवार को जाके मिल के उनसे पूछ के उनके बारे में आपने जो कुछ किया है, उसके लिए पूरी कंपनी को मेरी ओर से पूरी धन्यवाद।
Thank you.
Are you ready?
We are joined by Dr. Rucha Seth, a daughter of late Dr. Ashok Kapse. Dr. Rucha, are you there? You have to, yeah.
Am I audible, sir?
Yes, yes.
So I'm Dr. Rucha Sheth. I'm a radiologist and I am a daughter of Dr. Ashok Kapse. So he was, as we all know, he was larger than life and he had a very angelic presence. He was a very evolved soul. And like the other family members have said, throughout this pandemic, I used to tell him daily that I feel worried for you and I want you to close down your practice temporarily. But he always used to tell me that you're a doctor, and at a time like this, service and selflessness should be your motto. And don't worry, we are being very careful. And he was also guiding a whole lot of people. He was doing so much research as infectious diseases was his specialty. Unfortunately, when he contracted COVID, his entire life, he has only given help and service. If not help and service, he's given happiness and consolation, healing to people. And when he caught COVID, we had a really tough time. We were isolated. He went alone in the hospital. People could not come and meet him. We had trouble finding tocilizumab injections. And one after the other, he contracted a lot of infections and he passed away. But he went fighting like a warrior. And his words always ring true in my life that service and selflessness are most important. And that is what he proved in life and even in death. He went all alone, we were isolated. And just like somebody else said today that jab chal rahi thi practice, he was always surrounded by people and people took his appointments. But later when he came upon hard times, nobody really came back to ask you, and which is the way how life and world go on. But to the Mankind company, to the senior officials of the company, to the board, the panel, and to all the well-meaning doctors, I want to express my heartfelt thanks. Mankind has really shown the kindness that comes with being a man and being human. So thank you very much for the compensation. I'll make sure that we put it to the best possible use. But once again, I cannot put in words the appreciation. Your gesture and token itself felt very good to us. And even the officials who got in touch with us, specifically Mr. Bhupendra Yadav, he was extremely sensitive and very kind while talking and discussing with me about all this. So once again, thank you very much, and my very best wishes to you, and my prayers of healing and peace for all other family members who are grieving like me. So thank you.
Thank you, ma'am. Thank you once again for your warm words. Now I would like to again ask if Mr. Hiren Taylor can join us. He's younger brother of late Dr. Kamlesh Taylor.
आपकी आवाज नहीं आ रही है, मुंह में लाके बोलिए। आप अपने नहीं, आपने डिस्कनेक्ट कर लिया है अपने आप को, अनम्यूट कर लिया है। काइंडली अनम्यूट। नहीं, इनकी आवाज नहीं आ रही है। आप अनम्यूट करेंगे अपने आप को हिरेन जी? फिर आपने म्यूट कर लिया है।
I think he's gone on a call. His phone is coming busy, so.
नहीं, आवाज नहीं आ रही है आपके हिरेन जी। आप अपना मैसेज चैट बॉक्स पे लिख दीजिए, हम लोग पढ़ देंगे, क्योंकि अभी आपका टोटल डिस्कनेक्टेड हो गया है। यस,
आप बोल सकते हैं। आई एम पुटिंग यू ऑन स्पीकर। आप यहाँ बोल सकते हैं, people can listen to you.
Okay, sir. Thank you very much. I am completely agree with Rucha madam, Rajani madam, Yatin ji, and I am very thankful. I would like to thank in behalf of my family to Mankind Pharma, Hardcore Foundation, and IGCP for this martyr program, for giving such respect to my elder brother, let's say Dr. Kamlesh Taylor. I am deeply appreciated your expression of sympathy and support in absence of my brother to my family. This is I am very thankful to you. Thank you, sir.
Thank you, Hiren ji. And this was Mr. Hiren Taylor, younger brother of Dr. Taylor. And so you would like to add something?
Hi. Yes.
Yes, sir.
So I would like to say in the end, New Year has come. Let's take it forward. Let's take it a lowest mortality year. Let the number of cases rise. Who cares? So what? As long as we reduce the mortality.
Thank you.
And if you really want to reduce the mortality, I want to pass on some mantras. The first mantra is, don't get your baseline CRP done. All my medical doctors who are watching this program, or who are on Facebook or YouTube who are watching this program, get your baseline CRP done. If your baseline CRP is high, then this virus will cause very high inflammation in your body. Keep your C-reactive protein less than 1 as a baseline. If you don't, if all the doctors should keep their CRP less than 1. And if you are coming in contact with somebody, which is cumulative 15 minutes of contact, start immediately a prophylaxis. If you are in a COVID ward, you can think of the UP protocol of Ivermectin. And you can continue Ivermectin as per IMA once in a week, or as per UP protocol 7th day, 30th day, and then monthly. And if you come in close contact with the patient, you can start doxycycline a day for 5 days. And if you develop symptoms, make sure you are treated in the first 48 hours. CRP more than 10 on day 1, fever more than 101 on day 1, D-dimer rise more than 1 on day 1 means you are at a very, 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 very high risk. On day 3, you must diagnose the pneumonia by any cost. If your pneumonia is coming on day 3, so fever more than 101 on day 3 or CRP more than 10 means pneumonia. And if you develop pneumonia, you must attack at that particular moment. I just want to add extra what Dr. Raghu has said, that wait for hypoxia. So I would say I will treat it at the level when I see cytokine crisis has started. That is at least 24 hours before the hypoxia develops. So I would go and attack at that particular moment. By day 5, your CRP should become normal. And by day 7, your lymphocyte should start improving. If by day 7, your CRP is not reducing, and by day 7, if your lymphocytes have not started appearing, take it for granted you are heading for a cytokine crisis. So I basically want is to attack before day 7 by any cost, whatever you want to give. You want to give remdesivir, you want to give steroids, you want to give baricitinib, you want to give thymosin alpha, whatever you want to give, you have to attack early. If you are on a ventilator and give tocilizumab, you are going to end up into an infection. And now we have a better tocilizumab available as a baricitinib, which doesn't cause so much of secondary infection. So I say, treat early, become aggressive. Don't let the disease become aggressive. Give them timely zinc, doxycycline, ivermectin. Give them timely diagnosis of acute inflammation. And if you get acute inflammation, start anti-inflammatory right that particular moment along with blood thinners. And I'm going to end by saying, remember there are 2 types of fever. Fever number 1 is a thermoregulatory dysregulation fever, which is interferon or IL-6 fever, which is always less than 100.4. But if your fever is more than 101, starting on day 3, take it for granted this is IL-1 beta and IL-18 fever. And these types of fever, either they respond to mefenamic acid with colchicine combination, or they will respond to steroids. So if you don't want to steroid, if you want to follow the protocol that I will start steroid when hypoxia develops, at least give them anti-IL-1 beta therapy. Whatever you want to give, treat and reduce IL-1 beta. If you don't do that, and if hypoxia develops, then you know the patient is going to have rapidly deteriorating lung functions. I'm going to end by saying, between day 3 and day 5, if your CRP is rising instead of declining, if your TLC is not rising, or if your CT scan shows a rising pattern, take it for granted you are going to end up into trouble. Over to Dr. Manish.
Thank you, sir. I thank all our faculty members, Dr. K.K. Agarwal sir and Dr. Raghu sir, for coming in today and sharing their viewpoints. And I sincerely pay our gratitude towards all the family members who have joined in, to all the people who have been watching today. And hopefully we do not lose anybody anymore. And this new year brings more joy than grief that we have seen in the last 1 year. With this, I thank you all, and thank you for taking out time and joining us. Thank you once again. Have a wonderful evening.